Majumder. I'm an assistant professor at University of South Carolina, Upstate. So my today's talk will be on how we can predict early warning sign on mental health crisis, especially using Internet of Things and using AI technique, artificial intelligence technique. So the outline. So the outline of my talk will be like, first time I will talk about some background and the motivation of doing this sort of research. And then I'll talk about what is my approach, like how we are doing this research, especially using the Internet of Things technology and using AI technique, including some other like signal processing and predicting learning technique. Then I'll talk about like how we can build a wristband from scratch, like how we build some to collect different data like physiological data, like behavioral data, social interaction data to predict this mental health crisis. So that's I'll talk next. I'll talk about how we collect data and how we evaluate data, and then I'll conclude my talk with some future research direction. Okay, so I'm sorry. I'm trying to move. Okay, so the first is what is the IoT, like the Internet of Things, right? So the Internet of Things is nothing but the network of physical object, like we are using the devices, right? The sensors, how we can collect data using different sensors, and how we send data, and how we the different smart devices talk to each other through the networks. So that's the Internet of Things. So that's what we are using for our data collection. So then where you will see all those Internet of Things devices, like for example, a smartwatch, right? And what we are talking right now, the mental health, right? So most of the Internet of Things devices you will see in the healthcare system, right? How we collect and how we use those devices to monitor, especially the people with underlying conditions or some like sort of like way of collecting data through the network, right? So that's what you will see the application of the IoT. So today what I will show you how we collect, how we build a wristband, how we collect data by using some smart devices like smartphone, and how we analyze data to monitor mental health crisis for the user. So when I say the IoT, right, Internet of Things, so we always say this IoT is based on this ABCD concept. The A is application. When you talk about A is application, B is like big data analytics, then C is connectivity and devices. So that's our goal, like how we can collect data using these smart devices through the network, store them in a database, then analyze data to see how we can apply them, especially like monitor people's health, like mental health, right? So that's our goal, how we collect data and what devices we are going to use and how we analyze data. So that's called like ABCD concept of IoT. That's the big like basic concept that how we use our research progress, like what we use as a research. I'm sorry, I'm just trying to move slide. So the idea of our of this project is we are collecting data with different IoT sensors, right, like wearable sensors, using this cyber physical system from the user, send them to either database or in a smartphone, like using the smartphone application to monitor the health, right? By incorporating like hospital or like other agencies, local agencies, securely or trustworthy data, right? Using AI technique, artificial intelligence technique. So that's our like our one of the big approach of monitoring emotions or mental health from user using the IoT or AI sensor and using AI techniques. So that's the idea of our project, how we will collect data and how we'll analyze data, especially using smartphone. That's why I call this IoT AI mobile health, like for mental health detection using AI. So that's our big approach, right? How we'll collect, including we include this like COVID-19, especially COVID-19 cases. So during this COVID-19, how the mental health crisis increased dramatically. So the motivation of doing this research, of course, before this COVID-19 pandemic, the statistics based on Mental Health America, they said 1 in 5 elderly people have their emotional disorder, and they do not go to like seek help for this crisis, mental health crisis. This is even before COVID-19 pandemic. After when the COVID-19 started, like it says, in addition to this 1 in 5 adults, there are around 400,000 people screened even moderate or severe depression or anxiety problem. And also around 60 to 70,000 people screened or risk of psychosis, right? So in this is statistics in even 2020, and in 2021 it's increased a lot as well, right? In March 2020, when the pandemic started, right, it says around just right around the starting point is around 131,000 depression screen as well, and they actually reported that it's around most of them are about to thinking about like suicidal or self-harm more than once in half a day. So that's how severe this mental health crisis is, right? So after this COVID-19 pandemic started, and if you look at this graph, you see like when it comes to the May 2020 to August 2021, this all depression, anxiety, psychosis is increased dramatically. Like for example, if you look at this February, right, and then compared to this August, you'll see how this increase almost is exponential increment of this crisis problem. So that's how is so severely like important to take care of this mental health problem. So that's the motivation of doing this research. So now I think all of you know that what is biopsychosocial model, right? So when you're talking about this mental health, right? So we need to consider about the biological factors, psychological factors, and social environmental factors. So that's the research project is focusing, like how we can collect these factors using different sensors, different IoT sensors. Like so we collect data, psychological data, we collect social environmental data, we collect biological data. Now we're like, and we have different publication on different area, like we collect social data, we have publication on this area, we have psychological data, we have publication on this area as well. So what we are doing, like we are trying to integrate all those data to propose a generic framework, especially for early prediction of this mental health crisis, right? So that's what we are now doing, like how we can incorporate all these data factors, and then how we can determine their complex relationship to find if someone is posed to a severe mental health crisis or not, right? So our idea, like how we collecting data and what is the area of our research and how we collect data and to monitor this mental health crisis. There are many research in this area. Many people are working in this area as well. Especially they're focusing on like how these psychological characteristics can determine and like if you look at all the research topics, one is the big area is missing is privacy area, right? But our focus also not only this psychological, like behavioral or social, we also focus on how securely we can collect data and how securely we can monitor and analyze data to show that like what is the symptom of early detection, how we can detect early if someone is posed to a severe mental crisis. Also, like if you think about this cyber physical system, right? Cyber physical system, including the hardware, you'll see most of the research, they actually focus on like a lot of either hardware, if you think about hardware, right? And of course, including the software, right? But our proposed approach is we are not going to ask user to use any additional hardware beside, for example, just like a wristband or pendant or like, and a smartphone is always there carry with them. So it's not like additional hardware they require to use for our proposed system. It's like regular usable technology. They will then will monitor their data, their physiological or social interaction data or biological data. Not only we are focusing on Android platform, we also focus on iPhone platform, like how we can collect data in a different smart devices. That's also, and that's the difference between what has been done and why our one is different compared to the others. So for the initial data collection, what we have built, we built a smart wristband using different sensors like galvanic skin response sensor, we use pulse sensor, we use temperature sensor to collect it. This is our initial prototype of the wristband. And we use like Arduino and Bluetooth device to send data, this Bluetooth module to send data to the phone to collect this, like let's say pulse, and galvanic skin response means like respiratory level, like how are you wait or like how your skin is responding, right? And we also, as well as we also collect the temperature sensor, temperature data to monitor like emotional state, mental state, right? So that's our initial prototype, right? Then we collect data in a different testing scenario. For example, like we ask the user to rest and we ask user to exercise, which we simulate as a exercise, as a stress. We simulate happy with watching funny movie, like ask user to watching funny movie when they wear our wristband. We ask user thinking about some sad news or using like watching news, sad news, or thinking about low grade in a semester. So we simulate that situation as an upset. And we analyze data to find some emotional index. Like, so we have this pulse data, we have galvanic skin response data, we have beat per minute, like, and then we derive, I'm sorry, I moved that. And we use this derivative of this GSR and take the variance of this BPM pulse to find some emotional index for these 4 different scenarios, 4 different testing scenario. And we saw that right? Using our data, you can distinguish between if someone depressed, someone happy, someone is stressed, someone is calm, right? You see that by looking at this, the emotion index, we can distinguish the different emotion for individual subjects. So by looking at this, we can say if someone is happy, someone is stressed, someone is anxiety, someone is like have some mental crisis. So that's our initial analysis. Then we see we have some like issue with the wristband, like especially when you're collecting data, right? So we wanted to compare our data with the commercially available wristband. So one of the big, like very popular wristband, we bought this EM sensor, right? Which I think MIT Media Lab, they introduced this in back in 2017. So this wristband can collect like electrodermal activity, heart rate, accelerometer, temperature, like different data, different physiological data we can. And we also ask the user to wear this wristband, and we also ask the user to just rest and then watching sad movie. We have a different movie set, around 16 movie set. We have a movie clip like for sad, for happy, for upset. And we ask them to watch those movie clips using our wristband. And then we collect those sensor data to simulate when they are actually happy, when they are sad, when they are upset. So that's that. Then we started collecting data using this E4 sensor wristband, right? And then for different, so what we did, we collect data from this wristband, right? We performed some signal smoothing technique to reduce the noise, initial noise, right? And then we divide this data, collected data, for example, let's say heart rate, EDA, electrodermal activity, right? The corresponding to the movie clip they watch for sad, for happy, for stress, right? Then we process this data for classification technique. We ran in a different classification technique. Like one is we use a batch tree classification technique to see how we can distinguish between sad, happy, and stress. And then we run this classified data, we find very good results on the classification technique, the accuracy on the classification technique. That's how we analyze data. So we collect data, we reduce noise, initial noise, and we divide data based on the film that we ask them to watch, and then we process data for the classification accuracy. And this is the one of the results, confusion matrix for the classification technique. If you see the like true class and predicted class, right? You see like we got, if someone is angry, right, it's around 88% accuracy. When someone is happy, is around 98% accuracy. When someone is neutral, is around like 75% accuracy, right? So of course, this is based on true, false, negative, false, positive, true, false, like based on that. And then if someone said is like around 97% accuracy. So all these accuracies here, and then it is at the error. So that's what we saw, like using our collected data, we can like distinguish between different emotional state to find some mental health condition in user. So then in the third phase, we collect social interaction data. So I showed you some health related data, some like physiological data, and how we analyze and accuracy. Then we see the third field is like how we can collect the social interaction data. So we use the same wristband, and then we collect data when the user was playing the video game or board game, right? That's we call how they socially interact with each other by playing video game, by playing board game, including this mini game portion, right? So we ask them to be very competitive person, not like simulated. It's like play as you play, usually play. And we also there have different like audience, and we also ask them to always interact with the audience, answer their question, so that it simulate as a real scenario. It's not like, okay, it's a collecting data, it's for collecting data, so that we can actually simulate the emotional state. So this one we use for social data collection for social setting by playing the different game. Then we use those data to determine if when someone is happy, that means that he win the game. Or someone is angry, that means he lose the game, or sad, he lose the game, right? The based on this balance and arousal score. So we calculate this balance and arousal score based on this balance is function of like heart rate, and then we use this EDA data, the electrodermal activity data, to calculate this arousal level, like the minimum, maximum, and then I'll show you the equation that how we calculate this balance and arousal score based on the heart rate and electrodermal activity data. And we said this model, this is of course really, this model says this model will, if you see someone's balance score is greater than 5, so this is 5, and less than arousal score is less than 5, this is also 5, then we say is neutral. Like it says arousal is low, neutral, balance is neutral, high. So the balance is high but arousal is low, with content. We simulate happy situation when we see the excitement, the arousal score is high and the balance score is high. So that means the subject is very happy. So that's like happy. We simulate this in happy state. When you see the arousal score is high, but the balance score is low, which is less than 5, but the arousal score is greater than 5, we simulate that situation as an angry situation. When both are low, arousal and balance both are low, it's a sad situation. So that's how we simulate the different like emotional situation based on this balance and arousal score that we calculate using this heart rate and electrodermal activity data. So this is the equation I said, like we use this balance level calculation using the heart rate, right? And we use the arousal score we calculate using the electrodermal activity data, EDA data. Okay, and this is the calculation, like based on this, we collect this EDA and heart rate data, and we calculate this balance and arousal score. Based on the score, we calculate if someone is sad, happy, content, or angry. Look at this is low, both are low, less than 5, so it's sad. This is high, but this both are high, sorry, both are less than greater than 5, so it's happy. So this is high, but this is low, is content. This is low, this is high, so he's angry. Based on the model I showed in the previous slide, like for example, like this one. So based on the score, we can say if someone is happy, someone is angry, someone is sad. So that, and that we will try to determine how we can relate this to someone has a mental health crisis, right? And this is the scattered plot, right? If you think about like these four different states, so the 4 different emotion state based on this EDA and heart rate data and the arousal and balance score. And if you look at this, if this we calculate this arousal using the EDS, so these are the EDA data. And if you think about calculating this balance using the heart rate, so this is heart rate using heart rate, right? So these 4, 1, 2, 3, 4 that we use to distinguish between this emotion state like sad, happy, and content and angry. Okay. So this is another set of data. We analyzed data and we found this accuracy. And we also draw this histogram with outlier and without outlier for 2 different subjects. Like this is heart rate data for the subject 11, and this is heart rate data for subject 17. This is with outlier. If you see the outlier, you see this outlier, right? Outlier. But we saw that we can improve our accuracy if we remove this outlier. if you remove the outlier, you see, we saw that we can improve the accuracy of this emotion detection technique if we just remove this outlier. So that's also we did analysis to improve the accuracy of our mental, like detecting mental health crisis. So what we are doing right now, I'm not sure. I mean, I'm on time. Excuse me.
Well, if you can, only a few minutes because you have only 20 minutes, so it's some time more. But
Yeah, I'm almost
make
done.
some
I'm
conclusion.
sorry.
Okay.
Yeah, I'm concluding myself. Yes, it's just
Okay.
one or two slides. So what we are doing right now, we are using this model for detecting mental health crisis, especially during this COVID-19 cases. This model is called susceptible exposed infection and remove model, SEIR model. If someone is susceptible to the like COVID, and then if someone is exposed, then how probability of getting infection or probability of getting infection of clinical or subclinical, and then how someone is recovered from this. So this is recovery. So what we are doing right now, we are trying to have in this way, we can trying to apply this all AI technique, artificial intelligence techniques before actually someone get infected by this COVID, so that we can say, like, if we can prevent getting infected by informing the user, so that, and then they might not, if they don't infected, they might not have any mental issue. So that's what we are doing right now, right, using this artificial neural network technique. So we are using a different input, and the output is how susceptible or how like is, and how like someone to infected to the COVID, and how the mental health crisis involved with this. So we are using this artificial neural network technique, and then there are of course different hidden layers, and I said we have total 6 hidden layers in our analysis, and then first hidden layer have 10 neurons, then 10 neurons, 30 neurons, and of course I don't have time. So we are using this technique to find this mental health crisis before warning a user getting like a COVID-19. So in conclusion, so what we are planning to do in future, we have a like different idea, but we wanted to incorporate some hybrid software and hardware to securely analyze this data. And we wanted to go to this like clinical setting to collect data using our approach, right? We also wanted to use this smartphone technique to monitor these mental health crisis conditions. Thank you so much.